In this video, we're going to be talking about what it's like to have a pregnancy with a small growing baby, or what we call is fetal growth restriction. And so in prior videos, we talked about what it's like to grow a larger baby. Now in this video, there is some concern when someone is growing a smaller baby, and we're going to talk all about that, so stay tuned. Again, my name is Dr. Eric Schmidt, board certified OBGYN, part of the new school OBGYN where you get your information matters. So in this video, we're going to be talking about why does growing a small baby get our attention so much as OB providers? So why is it more concerning to potentially grow a smaller baby than a larger baby? Well, because growing a small baby or fetal growth restriction is one of the leading causes of perinatal morbidity and mortality. And so let's talk all about that, because it might be a clue to a potentially underlying process that might be going on. And so it gets our attention a little bit more. Big question, how do we detect that a baby is small growing? Well, like we talked about in the previous video for large babies, moms can detect this. And so if you feel like your baby is growing smaller, certainly talk to your OB team, say, you know what, I just feel like my baby's growing smaller. Can you please evaluate this further? Your doctor's probably already still doing those fundal height measurements, which is the centimeters from the pubic bone to the top of the uterus. That should match up and gives us a good clue. But often if we have any concern at all later on in the pregnancy, we're getting a growth ultrasound. And so this would be an ultrasound potentially later in the second trimester, third trimester throughout, if there's any concerns about a small growing baby, and this is how we would diagnose it. The diagnosis of a small growing baby or fetal growth restriction is when a baby is less than the 10th percentile. So, that's only 10% of pregnancies. So it is a little bit rare. This can be either the measurement of all baby's parts equal together, the estimated fetal weight, or we also classify if just the abdominal circumference is less than the 10th percentile. We call that fetal growth restriction also. So big question, why does this all happen? Well, there can be a number of factors. Number one, someone might just be genetically predispositioned, like this is the size baby I grow, nothing's wrong, baby's doing great, baby just grows around the 9th or 10th percentile, and that's normal for that individual or that couple. But other factors that can play into it, mom's factors, so mom's health, whether it's things like high blood pressure, things like other diseases of other organ systems, which would be like kidney disease, can make it so that babies potentially grow smaller. It may lead, and this also may play into the second cause, which would be placental causes, or what we call placental insufficiency. The placenta, for some reason, isn't giving baby enough supply and nutrients to grow to their full potential. And so this could be things like with umbilical cord, maybe the vessels of the umbilical cord are different, maybe the placenta blood flow isn't as good, maybe the placenta is smaller growing. All could play factors into this. Also, there are potential fetal or baby factors. Now, this could be things like there could be genetic, genetic abnormalities like aneuploidies, which would be things like Down syndromes or other potential chromosomal variations that could lead into potentially why baby is growing differently. Or maybe there was a thing like an infection during the pregnancy. We call these torch infections. They're pretty darn rare, but it's often why if someone has certain colds or things, we really want to know about it to see if someone had an exposure to a torch infection, which we would normally see on ultrasound if someone has had an infection during their pregnancy. And so often, depending on the size that we're estimating baby to be, can depend on the concern too. Because if baby is closer to the 10th percentile, meaning 8, 9, 10th percentile, this usually is a little bit less concerning, especially if they stay on that growth projected growth curve. And they're not dropping off of it. This may be normal for that pregnancy. Maybe more of that's just the size that mom grows. We'll pay close attention though throughout the pregnancy. Now, if a baby is growing in the more severe range, less than the 3rd percentile, we call severe IUGR, that's definitely going to get our attention more, and we're potentially going to alter the plan going forward. Because of this, potentially look for genetic issues or infection issues if patient has risks for that. And just to play off that a little bit, again, not all fetal growth restriction is created equally, and so a lot of times we call early onset IUGR. That would be if someone is detecting IUGR or growth restriction at before 32 weeks, and so less than 32 weeks, or late would be greater than 32 weeks along The early onset, if baby is experiencing growth restriction earlier on, it generally does have a little bit more concern. We're going to watch this a lot closer. And because generally in the first half of the pregnancy, a lot of babies are growing at the same rate. There shouldn't be a lot of variation because a lot of the genetic, a lot of the environmental factors that contribute to the pregnancy growth haven't really set in yet. That happens more in the latter half of the pregnancy. We'll talk about here in a second, how we pay attention closer in these pregnancies. Other terminology you might hear about when discussing IUGR would be things like, is the growth symmetric or asymmetric? Now, symmetric would mean all parts of baby are growing small. Asymmetric would be if baby has normal growing head, but the abdominal circumference is significantly less, one less than the other. Both of these could kind of mean other things too. All right, the important part of all this is how do we pay attention to these pregnancies and make sure that both mom and baby stay safe? And so this, once we detect IUGR, we diagnose it, we're often doing a number of ultrasounds throughout the pregnancy to monitor the growth, usually anywhere ranging from every 3 to 4 weeks or so. Again, depends on the severity potentially. And also at a lot of your appointments, you might be getting what's called an NST test. Now, this is where we listen to baby's heartbeat for 20 to 30 minutes, and we're looking for certain things that give us reassuring markers. And so you might have one of these tests for this reason or potentially other reasons when we have a higher risk pregnancy. And there's also things called a BPP, which gives you a score out of 8. And you're looking at, ultrasound findings that give us reassurance that baby's doing well. And this is a BPP. Something we can also do during that ultrasound, which would be Dopplers. So Dopplers would be with the ultrasound, we're able to measure blood flow. And so is the blood flow flowing through different areas of the placenta and baby well? And so we take all this into account, and baby's size when we're coming up with the best plan for you. And so often the combination of baby size, our level of concerns with these tests, we're coming up with your delivery plan. And so if a baby is growing small, I think there's this misconception that if a baby is growing small, you want the baby to stay inside longer. And that actually really isn't always true. So if we get to certain points of the pregnancy and baby's growing small and we have concern, and for example, that placenta is not supplying baby well enough, it could get dangerous the further along you get. And so that's why we might recommend an earlier delivery than expected for a small growing baby. And this can range from just a week early to potentially a month early to maybe even earlier than that. Again, depends on the combination of factors, level of concern. It might be easier for your baby to grow on the outside and get those nutrients on the outside than to get it on the inside from the placenta. And so I think that's just a common misconception is that, my baby's growing small, I need more time to grow my baby. No, actually, it might be potentially a little more risky to do that. In conclusion, I want to say that, again, growing a smaller baby is common, to have a baby growing smaller. And so what you just need to do is follow your doctor's recommendations and see what kind of testing additionally you need to do to evaluate this to make sure it's none of the scary reasons why. And it's just that's the size of baby you grow. And so talk with your doctor, see your doctor in regards to these issues, and they'll guide you through a safe rest of the pregnancy. All right, everyone, have a great holiday. We'll talk to you soon.